Perfect. Okay, so good afternoon, everyone, and thank you so much for joining us today. My name is Katie Bizaha. I'm a program officer at the New Jersey Healthcare Quality Institute, and I'll be serving as the moderator for today's conversation. And today's session is a part of our Conversation of Your Life initiative and a part of our newly formed Culture and Conversations series, where we explore how culture shapes the way that we think about and approach advanced care planning and serious illness. And so today we are going to be focusing specifically on the Latino community and the importance of culturally responsive approaches. And I do also want to shout out our colleague, Christy Lee, who has been our Rutgers MSW intern this year, who developed the concept for these sessions. And we are so thankful for her for coming up with this great idea. Um, and before we do get started, just a few things for housekeeping notes. Just stay on mute when possible, unless you are speaking. Feel free to utilize the chat for questions and comments, and we'll be having time for Q&A towards the end of the session. So you can reserve your questions for that Q&A component, but you can also drop it in the chat if you're like me and you might kind of forget your question along the way. We'll be having some of our QI staff, like Christy and Issa, taking a look at that chat and making sure we don't miss any of your questions. So just a little bit about the New Jersey Healthcare Quality Institute. We are a nonprofit independent organization that brings together providers, payers, community leaders, and policy experts to improve the quality, safety, and affordability of healthcare across our state. And one of our flagship community health initiatives is the Mayor's Wellness Campaign, which helps more than 400 plus New Jersey communities create healthier environments for their residents. And this is just a little bit about what COYL is, and it is a program designed to empower people to discuss, document, and share their healthcare wishes. And we focus on making advanced care planning part of everyday health and wellness. And we do partner with social workers, health professionals, faith leaders, librarians, community workers, and advocates, attorneys, etc., to create a space where people can talk openly about what matters most to them. So I got a little ahead of myself. But just as a little bit of a stronger introduction to today's session, we will be focusing on how culture can influence the way advanced care planning and serious illness conversations happen. So our beliefs around aging, illness, decision making, and family roles are shaped by cultural values and generational experiences, and those perspectives can influence when and how people feel comfortable planning for the future. With this session, we're specifically focusing on the Latino community and the importance of that culturally responsive approach to advanced care planning. Research shows that Latino patients are less likely to engage in advanced care planning conversations or complete advanced directives, often because of barriers such as language, access to culturally relevant information, and differences in how families and support systems approach healthcare decision making. At the same time, family support, faith, and community connection are powerful strengths that shape how those conversations happen. And we do know that those conversations often don't start in clinical settings. They happen in moments of crisis, within families, or after difficult experiences where decisions had to be made without prior conversations. So today we want to explore what that actually looks like in practice. And according to a 2019 study, 80% of people are aware of advanced care planning, but about 66% had a reason why they didn't want to or need to. And the number one reason was because many believe that their healthcare providers either wouldn't actually listen to their wishes and then follow closely by the assumption that their proxy, decision maker, families, they'll automatically know what they want, right? So we're going to explore how those conversations actually happen today in real life within families, across cultures, and often in complex and emotional situations. As questions do come up, we do encourage you to share them in the chat as I shared. And I do want to invite you all to participate in a brief icebreaker using a Mentimeter. So if those of you aren't familiar with using Mentimeter, you can either use your phone right now and you can scan the QR code on the screen, or you can type into the chat menti.com and then use the code 38093422. And Issa's going to pop it in the chat as well for us. And I just want you to share in one word, how does your community or culture tend to approach conversations around serious illness or future care? I'll just give everybody a little bit of time to pop that on. And we're going to just kind of see a word cloud kind of pop up and talk about a little bit of those themes that might come up. Oh, I have an echo. Thank you. Don't know where the echo is coming from. Let me see if I can adjust my mic, Sharon. Maybe this is better, but I'll see. See, I see avoidance, cautiously, quietly. Thanks, Sharon. Any other thoughts? And if it's two words, that's okay too. I just thought that this was just going to be a really great way to get us chatting a little bit in advance about, how do these conversations come up? I want to see. This is working. Okay. Avoidance and dismissive, fear. Yeah. Some reason it's not populating well. I don't know. Sometimes it works, sometimes it doesn't. But let me just switch my screen share real quick so you could see all the other wonderful responses that we have. Right. Delicately, taboo, sometimes openly, but I'm seeing avoidance, right? Like as that big part. So we might have gotten a few people that shared that, not approachable, compassionately, honestly, accepting. Yeah. Nervously. Great. Yeah, thank you all for sharing. This is just like I said, a quick way that we can discuss what that looks like in our communities and, how it might be different across our different cultural backgrounds. We heard in preparing for today that these conversations are not a one size fit all approach, and they're shaped by trust, relationship, language, and lived experience. So I'd love to just start with how that shows up. In our day-to-day work. And so with that, I'm going to introduce our panel as well. So we have Jenny Arias, who is a senior community health worker with the Health Coalition of Passaic County, Dr. Lisa Herks, who is a medical director at Parker Family Health in Red Bank, and Katy Dominguez, who is the community engagement coordinator for the Latin American Legal Defense and Education Fund. So I wanted to say first, thank you so much for joining us today. And we're really happy to have you join us for this conversation. And before we get into the specifics of advanced care planning, I think it would be helpful to ground us in your role because these conversations can look very different depending on how you engage with patients and families and community members. So to start off, and this question is to each of you, what role do you usually play in these conversations when working with patients, families, and community members? And feel free to unmute whoever wants to start first.
I can start. I'm a physician and I've had different roles over my lifetime in my work. For about the first 15 years, I was a primary care doctor. So my conversations started very early in my relationships with the patients. And it was more, you just get to know the patient. You get to know everything about them, their wants, their hopes, their aspirations for the future. You get to learn about their families. And it's actually much easier over time to start to work on that with the patients. And you can sort of sneak in. So, have you thought about if anything happens to you, if you get sick, do you know what you want for yourself if you can't make a decision for yourself? Or what do you want if, just to get those plans sort of in order, and have you spoken to someone in your family? Do you have a spokesperson, which we would now call a healthcare proxy? So it's much easier if you can start at the beginning of a relationship, not the first day, but the second, third year, depends how old the patients are. If it's an older person and the family members come, it's very easy to identify who the caregiver is. Later in my career, I went to academic medicine and I became a teaching attending, and I took call with residents, and I would walk into disasters. People had massive strokes, had massive heart attacks, were not going to make it, and decisions had to be made very carefully. And that is absolutely the worst time to have to do that because very quickly you have to establish trust. the patient or family have to look at you as somebody who will guide them and will make, I don't want to say decisions because decisions are joint, but help them make the best decisions for them based on their faith, their culture, their expectations, and how they envision the end of their life. It's very difficult. What I always do is I sit down, my team will be there, and I very quietly explain, what the situation is from my perspective. And then I ask them to tell me what they heard, because often what I have said is not what they hear because they're in shock. They're overwhelmed. And then when I hear back what they've said, we talk about options. So has your mom ever said what she would want if she needed to be put on a ventilator, or she needed to have CPR, or if her kidney stopped working? And that's a bad time to do it. But very often someone in the room in the family will become the spokesperson and they will help you make that decision. But it's really difficult. It's very difficult for Latino families. It's very difficult for Anglo families. I found my Latino families are much more protective of their family members, and they often want to shield them from the information that's being given at the time. And that's also difficult because you have somebody who's an extremist facing the end of their life, and you want them to be as aware as possible, but you have to also respect the family. So it's really complicated. It's so much easier if you can establish this early in the relationship. And when you come into the emergency room or you come into the ICU, they're like, this is Dr. Herkus. We know her, we trust her, that kind of thing. And when you're brand new and you're walking in the door with your white coat, the instinctive to be defensive and protective of your family is very natural and very real.
Yeah. Thank you so much, Lisa,
Oh, you're
for
welcome.
sharing. And yeah, I'd love to hear also from Jenny and Kathy.
Yes, I just want to echo what Dr. Lisa says. As Latino, my name is Jenny. I'm community health worker for the Health Coalition Passaic County. In our organization, we work one-on-one with our community members and different programs that we provide, senior programs, diabetes program, and also maternal child health program. So yes, our Latino communities, we are very reserved when it's coming to crisis of illness. We don't, we hide it. We don't have an open mind to talk about it. And when those serious conversations come, and the day by day when we meet our members and we do the first assessment, when we start conversation, introduce ourselves, what we do, that we have to follow them, we start to building that trust so they can open up a little bit about any care plan that we're gonna have through those days that we're gonna be working with them in the program. And one of the main question we ask them: who is the house coordinator? Who is the one making decisions for follow-ups, doctor's appointment? So the person that I can talk one-on-one, if it's then perfect, but most of the case they are not them. It's the wife, it's the daughter that has to arrange the doctor's appointment. And a little by little we building that trust and going with them with the follow-ups with the doctors, and knowing them a little bit more, and let them know that there is somebody that helping them and guide them when those
Yeah.
crisis moments are coming, when it's reflecting illness, serious illness, and advanced care plan that is coming.
Yeah. Thank you so much, Jenny. And I will also ask Kathy, and just as a reminder, we're asking, what role do you usually play in these conversations when working with patients, families, and community members?
Sure. My name is Katy Dominguez. I am the Community Engagement Coordinator for the Latin American Legal Defense and Education Fund, or LALDEF for short. We are a nonprofit here in Trenton, and our focus is mainly in the Mercer County immigrant low income community. And at least in my role, what we see is mostly families or individuals coming in because they don't know what to do and they need some guidance. Maybe in this scenario, like a doctor will tell you you need to fill this out and they don't know how to, right? Either they don't know how to read or they just don't understand. It's not in their language. So that's where we kind of step in and try to offer that guidance.
Yeah. Great. Yeah. Thank you all for providing that context. It really shows how many different entry points there are to these conversations and like at what point in people's life they might be entering those conversations, whether they're not in crisis or are in crisis, earlier in the lifespan, and later in it. But moving into our next question, how do you typically introduce advanced care planning or serious illness discussions when working with Latino patients, families, or community members? And what helps people understand what these conversations are really about? And I think we can round robin and jump in and support each other if that's fine with y'all.
It's interesting because it's kind of similar with all patients and all cultures, but you have to be a bit more sensitive in the Latino families to the role of the family. Um, Very often a patient will come with a caregiver. If they don't come with a caregiver, it's really important to establish who the caregiver is and involve that caregiver when you have a situation that is getting complicated and you have to make those decisions. I usually begin them very quietly, and I say things like, I know that you have had cancer and you've been to all these treatments, and things may not be going as well as you had hoped. And hopefully, the daughter, or the son, or the wife or husband are there. And, pretty much read the room quickly and see how they're responding to the news and then take it from there. It's a very delicate, careful conversation that you start slowly, and then depending on the feedback you get, you can progress.
Right. Yeah, absolutely. And Jenny and Kathy, did you want to add anything to that about how you typically introduce these conversations?
Yeah, as a VA working in the community member and working with my majority of the members are Latinos. One thing is that when it's coming to make a decision, it's not only one person, it's everybody.
It's
And
true.
yes. So one thing we have to be mindful is that when it's coming to share health information, and we have to keep it in very close, maybe one daughter, maybe one son, maybe you and I. And then they can share with the rest of the family. But one thing I can see also is that we're very, very, very happy person. And as a Latino, I'm gonna say, but we never want to hear about what you should want to plan ahead if anything happened to you. We don't want to hear that as a Latino. We most of all Latinos family, we just like that. And that is one thing, is a method. And then we had to break that ice when we have those conversations with them. And starting more conversations with the member and tell them how it feel home, and how long you're not been going home. So in the background, the illness, what is gonna happen, the process, what is gonna happen, and then even with the maternal child health program, those care plan conversations before the mommy, we're gonna have the C-section of before the mommy is gonna have the delivery baby. Let's make a plan. Who is gonna take care of the baby? That simple thing. What is gonna happen? Anything happen through the anesthesia? Anything can happen. Even a small procedure, anything can happen. So little by little, you start to build that trust, and they open up a little bit, and that's how you're gonna start and how you're going to build that relationship with them.
Great.
Yeah, I think for me, a lot of what I see here is it's individuals coming, maybe not with a family member, but with someone who's helping them navigate everything. So it might be a friend, or maybe that individual themselves doesn't have family here. So then that's where those conversations can get really difficult. It's like, okay, do you have someone who can support you? And if they say no, it's like, okay, well, now we have to think through, do you think you can ask someone, right? Are you involved with any organizations? Kind of trying to think outside the box to see who can definitely support them in that sense. But I agree with what was said before. It's definitely something that you want to tread carefully with, especially because I've seen maybe people are taken aback, or you automatically see that mental block come in, right?
Mhm.
And then it's like, okay, well, let me take a step back. How do you feel about this? Things like that.
Yeah.
Yeah.
It can be really frustrating as a healthcare provider because you know intellectually and instinctively that something is going to happen and you want to help them make decisions before you hit a crisis. But
Hmm.
sometimes you just have to let things take their course with families and patients, and sometimes they just hit the crisis, and you have to deal with it then. But generally, my families are very protective, very quiet, very reluctant to share information with the family member about how sick they really are. And that makes things really complicated. I think you just have to, follow their lead to some degree, even though it may not be your instinct. I want to get that paper done. I want to know what we're going to do. I want to move on to the next issue I have. But you really just have to let them sit with it until, things evolve.
Great. Yeah, I'm hearing just a lot of trusting the families that they're capable and understanding to navigate the experience, and that our role is often in helping guiding them towards that decision making, while also empowering them with the information that we're able to share with them in a culturally responsive way. Oh, great. Yeah. And I think we touched on this a little bit, but just diving in a little bit about the Latino family structure and that healthcare decisions are often made more collectively than individually. And I guess like how does that usually show up in your work when discussing advanced care planning or legal decisions? And are there any logistical or documentation challenges that show up?
Mhm. It gets to be a real issue in the hospital because most hospitals, both the nurses, the doctors, the whole structure, wants an identified decision maker in the family. And it gets really frustrating when you have six daughters or sons calling the ICU and saying, "What's going on with mom?" Whatever. Um, so that gets to be difficult. It's really important to have them come to a consensus, which is so hard. And very often with you have big families, you'll have somebody who's like, absolutely not. I do not want this to happen to mom or dad. And then you're sort of at a standstill. And that's when things get really complicated. And you have to, then try to negotiate with the family to work together. Or, sometimes the majority wins and that the one person is unfortunately very distraught. But it's very hard.
Yeah.
Also, I would like to jump in, and I just want to say that for this can be also very cultural barrier
Mm,
when it's come up that you had to start talking those conversation, and also language barrier.
yeah.
A lot of our Latino community, everybody speak English, speak Spanish, and they come to the doctor's appointment with their grandson, with the daughter. Maybe they don't understand exactly the meaning while we tell them in the right moment. And Mr. Jose, do you understand this is gonna happen to you? The process was gonna happen, this and that, and they in the la la land because they don't understand. So language barrier and cultural is a lot of influence barrier in this topic. So it's getting better because now the new generation of Latino, they're more prepared. And
Mhm.
because the son is daughter, they make the plan. Oh, mom, I just wanted you be understand that if anything happened to you, I have everything taken care of for you, so you don't have to worry about it. When those crises come, it's going to be more easily. It's going to be more smooth. But
Mhm.
cultural barrier and language barrier is a big kid, and when those topics are coming.
Yeah, we find that as well. I'm not fluent in Spanish, but I do speak Spanish. And sometimes I'll find a grandchild or a girlfriend or a boyfriend or a spouse is not telling the patient what I'm telling them.
Yes.
Mm,
We do
Mhm.
overcome that in our clinic and that we have interpreters. And even though think I'm getting very much better, I usually almost always have an interpreter and they're bored, but Sometimes it's just I need that because I'll get to some word or something and it's a real subtlety and I'll hear them explain it in a different way. But it's so important to know that the patient is getting the direct interpretation of what you're saying because sometimes it's not what you hear. So we
Exactly.
usually have interpreters if the provider is not fluent.
Yeah, and as a community health worker, also we find the resources that the member need in the community, local community, and also we have a public directory resources called United. So we type there the service that they need, and we make sure we put the barrier language Spanish. So the contact information, they're going to have the right contact person that is going to speak with them, is going to set up appointment, and is going to help you through those hard moments and then we follow up with that person and then we follow up with the member and say do you understand what you're going to go through, do you understand what the service is about and all of that. So it's like a map that you have to follow step by step. It's not easy, but you get there. There is a lot of
Mm.
resources available in the community that now is a different page, and also the hospitals they're doing a great job having all those different programs now with the palliative care, but it's still there. We need to be more open in the Latino community when those come those topic.
Mhm.
Great. Anything you wanted to add, Kathy, before I pop in?
Sure. Another thing that I was just thinking about was also going back to language barrier. It's also cultural, right? Different countries have different ways of naming things. So how do we know that what they're saying is actually accurate? Or maybe they are translating it, but in a way that their parent will understand. So I think
Mhm.
that's also like another nuance that comes into it.
Yeah, absolutely. And I often think about it, when we think about interpretation, that word, right? It's like how are we interpreting it? But also that the person that's close to the patient or community member might just be hearing this also for the first time and having
Mhm.
to like revel with like what that decision looks like, how I'm going to have to be the communicator to my mom, my father, my uncle, my sister. Um, and so that when possible, if it is possible at the organizations we work with or whatever, having like an interpreter in the room might be a really helpful a non-related or
Mhm.
interpreter might be helpful just also for that other person in the room that might have to deliver this information. And it kind of gives a little bit of space for them also to like take that in, right? Because it might be the first time they're listening. So I really appreciate you bringing up that uh, interpretation does matter. And, every culture within the Latino community has a different way of saying things as well. So thank
And it's
you.
interesting because I've had family members who are brought in as they want to interpret for their family, suddenly saying, I'll say, would you like an interpreter? No, no. And then so they're like, yeah, I want an interpreter because they need to step back and hear that too. It's overwhelming for the family as well.
Absolutely. Yeah. Thank you. And my partner is first generation born here who is Peruvian, and he's like, though I know most words in Spanish, I don't know all of them. Um, and so sometimes he might not know how to like tell like what the specific thing is. So yeah. Kevin, I do see that you have your hand up. I wasn't sure if you had a question and yeah.
Just a comment.
Yeah, go
Can
ahead.
you can hear me?
Yeah, thank you.
Yeah, I mean, I I'm listening to this wonderful conversation. Shout out to Jenny. I work with her, and
Yeah,
I'm enjoying the conversation as an Hispanic American dealing with some of these things in like my family and friends and people that I know. Also, as a former interpreter myself and dealing with all 21 countries. So I know, I mean, I speak from the privilege of being a Caribbean Hispanic. Most of my family have been citizens for 100 years. So it's a little bit different from Central and South American experience. And I just wanted to add that, like, apart from like the natural mistrust that you might find generally, I can't speak for every Hispanic person on this call, but apart from the general mistrust that the Hispanic community will have, sometimes because of religious mores.
Mhm.
Uh, that general mistrust is also exacerbated by just an inability to serve the older generation as well
Mhm.
as we'd like to. So if you can imagine, society has created now time that you can take away as a caregiver. That didn't exist 20 years ago. Or
Hmm.
maybe it did, but not as much as it does now.
Now,
Yeah.
But imagine if you're serving in a restaurant or
Mm.
driving Uber or or you just have a job that doesn't provide these perks, or maybe that's like a right that you have in the workforce, but you
Mm.
readily have management that will help you navigate through that and take time that you need. They don't want you to take that time. Then
Hmm.
it's you can even if you did trust, um, you know, the
Yeah.
secular medical field, you don't have the time to take care of somebody and take care of yourself and your health and your children. So that
Yeah.
whole sandwich generation thing is exacerbated times 100 in the Hispanic community, on top of all the language barriers, the cultural barriers. It's really hard for the Hispanic community, who, uh, as much as any other
Yeah.
immigrant community, but possibly more, it could
Yeah.
probably be proven, has to adapt to secular culture, its own religious mores, its own Hispanic culture, and when other cultures are celebrated and put at the forefront or used in a campaign to advance public health initiatives, Hispanics often have to fall in line behind that. And
Yeah.
that trickles down beyond the community worker, like Jenny, who's doing amazing work, to even just the people that we serve.
mhm.
Yeah. Thank you. Thank you so
So
much, Kevin,
So
for
that's
that insight.
part of the perspective there.
Yeah, thank
Yeah.
you.
Thank
Really
you.
valuable, and thank you so much for sharing with us. We really appreciate that. Um, And that kind of leads us a little more into our next question, which is about language, trust, and communication styles and how they shape those conversations. And so I think let's start from an opportunities. Like, what opportunities have you seen when discussing advanced care planning with Spanish speaking patients or families? What are those strengths that you're seeing um, that we who support community members can lean on to make these conversations easier?
One thing that I see with a few of my community members that they value the religious side.
Mhm.
They lean a lot when those conversations come. They they tell me, "Oh, Jenny, I did have a conversation. I just do a follow up after I have those conversations with them. I did have a conversation with my pastor, and I think this is this that." So we have to be very respectful with their values and their belief when they come in. So I see that they lean a lot to their belief.
Yeah.
Mhm.
Yeah, that's great. Yeah. Um, I know that belief across all cultures really plays a strong component and is definitely something that we can be more educated around to see how we can, again, see that as a strength, not as a barrier. Uh,
Mhm.
Lisa?
I find faith is very reassuring to people. People who don't have faith and don't believe in an afterlife or um, other things have a harder time often facing death. It's really very reassuring to have faith and also to family support. I mean, it goes hand in hand. You have your family there to comfort you and help you through the process, and you also have your faith. And I found that my patients who were faithful in general, had an easier time. Very important. And, it's very important for me. It has been important for me as an instructor to educate my residents and my students to be sensitive to other people's beliefs, their culture, their family. You have to use substituted judgment a lot of times where you have to say, well, what would your mom want? What would you want? That kind of thing. And it's really important when you're in more of a supervisory role than in a primary role
Mhm.
to educate other people. Now, I am not Latino, but I feel like I've been around the block a lot and I've had a lot of experience with different cultures and our Latino patients. And I find that's so important. The faith is so important, family is so important, and then educating the people that you can, that they need to support the patients in the way that they should be supported, support their faith, support their family. So important.
Yeah, and for those Latinos that some of them are ready, like they know what they're gonna go through, and then when I have those questions, they say, "Don't worry about Miss Jenny, I have everything take care." I even went to the embassy, and they have a that's what they told me. They have like a package. If anything happened, they know, they wish and they believe they want to go back home. They know
Mhm.
what is the next step to take it. And we were there to support them, to help them with more resources if they needed more resources. But there are help available. And for those Latinos, they want to go back home. That's the wish, they want to go back home. They have a package in the Peruvian embassy, Argentina embassy in New York, Ecuadorian embassy in New York, and the Dominican Republic here, and Patterson, New Jersey. Those resources are available for those they plan to go back home,
Yeah.
and we just have to respect that and support them for that they wish. So that is it's a great thing.
Yeah.
I mean, that's an amazing thing to have. I'll tell you, at the end of life, people ask for two things. They ask to go home and they ask for their mother. So, we can't always provide the mother, but the idea of being able to go home, whether it's before or after you pass, that's got to be wonderful.
Yeah. Thank you. Kathy, I saw you on mute too.
Yes. I also just wanted to add that I think it's also important to emphasize the benefits of advanced care planning
Mhm.
because if you're for a family that might be going through this tough situation, they might not see why they need, it's just another barrier. It's just something else that reminds them of what's going on, right? But they don't really think about what happens next. And that's where advanced care planning can really play a role. So if we kind of try to explain the benefits of it, I think that'll be a lot more helpful, but also a lot of patience. I find myself that I have to repeat stuff constantly, but I try to change the wording or maybe change the inflection or go slower, whatever it is they may need so that I feel comfortable knowing that they did understand what was going on. Or sometimes it's something like, you know what, let me just write this down, print it out for you, and you could read it at your own pace at home. Call me if you
Mhm.
have any questions, or feel free to come back. I always make time for you.
Yeah.
Things like that.
Absolutely. And as much as important as the documents are, I think it's that first conversation or those ongoing conversations that are really going to be the most impactful when it comes to that decision-making process in an emergency situation or when somebody cannot speak for themselves. Because at least at a minimum, they were able to talk to the people around them about what their wishes are, and hopefully that person will be able to communicate it. The documents are absolutely like a plus and a, like gold standard, but if we're able to at least get them kind of talking with their family, their neighbor, their whomever is going to help them with that decision making, um, yeah, it definitely can just be really enlightening and make the whole process easier, right? That benefit that Kathy was talking about, like some of those
Mhm.
benefits of like advanced care planning and having those earlier conversations. Yeah. And I wanted to ask, and I know it's so hard to like narrow it down to one, and I hate to phrase the question this way, so feel free to also like name two, but if there was something that you would want more health professionals to understand or people that work with the community to understand about working with the Latino community when discussing serious illness and advanced care planning, what's something that really sticks out to you? Or that you as an earlier practitioner or a community health worker or community coordinator would have wanted to know.
One thing that as a community health worker that I learned sometimes with have a different perceptions from the person, and we have to be mindful from the background that they coming from.
Hmm.
And when that's one thing that I really focus about it, that everybody's, even with our Latino, we all have different backgrounds. We all have different beliefs. We have different cultures. We have different, which is the things that how we see it. So we just have to be mindful of professional health cares, that background is very important when it's coming those topics. So that should be more emphasized. I'm a little bit more careful, you know.
Mhm, mhm. Yeah, they're
Right.
more sensitive. I mean, this is a very hard topic for anyone to hear, but I think that with my Latino families, you have to be more sensitive, not only in what you tell, but how you tell the patient things and the family. It can be a bit of surprise if you're not used to the culture and you haven't worked with Latino families before, but you do have to involve the family. It's not just a one person decision, but you have to be so careful because you have to assess where everybody's coming from. It's not a one size fits all conversation.
Thank you.
I think for me, it's I guess letting go of all assumptions. You know, when I first started, and I was seeing that many of our clients maybe didn't know how to read or write. That was really shocking to me. It's like, what do you
It's
mean?
huge.
You know, or maybe that someone doesn't know how to find their email, doesn't know their phone number. Things like that that just come so easy to us, or because we do it every day, they might not know, right? So I have
Hmm.
clients who will come in, it's like, oh, I'm sorry, can you just download this file for me? I don't know how to send it through email. Can you please do it for me? So I think really truly letting go of every single assumption and just working with the client, seeing them for who they are, that will really be helpful.
Yeah.
Some of our
Yeah.
patients don't have emails at our clinic, which is really eye-opening to a lot of people, but a lot of them don't.
Hmm. Yeah. And there might even just be a conversation there, which is like, is there a way I can help you with that? And knowing about, all of the different spaces and places in your community.
Mhm.
You might not, like yourself, maybe you're like, I don't have capacity for this, but I do know Jenny, and she would be able to help you navigate that. Is that something you feel comfortable with, right? So when we know about those places and spaces and resources,
That is,
um, then we can help support our families, residents, community members.
yeah,
Jenny?
to emphasize to them that they're not alone this journey. There is a
Yeah,
lot of resources for them available, which is great. Uh, Financially, systems and things like that. Yeah. So
yeah,
we just have to support them and be there for them and try to navigate them to this journey, which is not hard for them.
yeah, absolutely. Yeah, thank you so much. And I am going to swing into our Q&A/comments. And so you can drop questions in the chat and I can read them, or you can put up your hand and unmute. And Dennis, you have been so patient with us. So if you wouldn't mind unmuting and either sharing your thought or your question for the panel.
Can you hear me?
Yeah, perfectly.
Yes, I just wanted to share. I thought as somebody who doesn't speak Spanish, but I've worked like with the Spanish community in Passaic area, and one of the things that I learned when I'm using an interpreter is that I was not always assuming that the client is getting the correct the translation. So I kept on asking which country do they come from? If it's the dialect right? Are you
Mhm.
did you get what the interpreter does it mean what he's saying? So I will always ask follow-up questions to get to the what the client means exactly so that they could explain better so that we don't assume that whatever there is being interpreted is the correct version of what they were asking for, or what we are looking for, and also to make every encounter be as open and as comfortable to win their trust. And this, to me, made my work easier with the Spanish community. Be open more, smile more, ask for
Yes.
clarification often. So I think this, having worked for me, would work for anybody who wants to talk to somebody who speaks a different language than from them, and getting to get what they need from them, and also them getting what they need from the community health worker. Thank you.
Thank you so much, Dennis. Did our panelists want to chime in on
Yeah.
that? Yeah.
Thank you so much, Dana. It's true. It's to build that trust and to make sure what they need, if they get the message right, even with the interpreter line that they sometimes they interpret translate the things and the member don't understand exactly, and then those trust steps that is going to build where you want to be and the goal that you want to make with that member, with that patient one-on-one. And that is when it's so important. And those questions, why, when, how you feel, how can I work with you? And I'm available this day. You can reach me out. So be supportive for them. So that's what we do in the community. Thank you so much, Dennis.
Thank you. Um, any other questions or reflections, experiences? I think panels are always great because we do have our three lovely experts in the room, but I also know that everybody that's probably on this call has some level of expertise and knowledge that if they would like to share in the way that Kevin and Dennis did as well, we're open to that too.
Hello.
Hi. I'm like, I can't find you, but I will find you.
I'm having issues with my laptop, so I'm on the phone.
Oh, that's okay. Yeah, feel free to chime in.
So I would like to add a strategy that I use with I work with the senior population, so like 90% are Hispanic. So I joke around. I speak a different in certain countries. So the strategy I use, I pick up different dialect from other countries, and I ask my seniors like, "Oh, what does that mean?" So I could always have that in the future of like, okay, if they say something, mention a certain thing, I'll have that in the back of my mind. I'm like, oh, okay, that means that. So like, for example, in South America, ahorita means right now, and in Caribbean Spanish, ahorita means later. So I kind of like pick up on the certain dialect, and I kind of just have that in the back of my mind and study it. And when I'm having conversations with my seniors regarding anything or any health concerns they have, they want to talk about, I'll have that knowledge.
Oh, we did lose you, Anthony, but I think you were breaking up. But yeah, that is such an important understanding. And I love that you're taking that like proactive approach to understanding that like in different dialects, like one thing might mean one thing and the other thing might be, and it means almost like the example that you gave us is like the complete opposite, right? So yeah, anything that the panelists wanted to add to that?
Yeah, that is a great key to be approachable, and to when those moments of crisis, they feel that you have that trust, and then for those they have to understand, and we have to be respectful with everything, and then when we build that trust and to remind that little things, oh, Senor Jose, did you say something that came into my mind and all that? I say, oh, yeah, it's like a kid for them. So
Mhm.
yeah, that is very important.
Great. Yeah, and I saw that Danielle Morales asked, how do you respond when a client becomes angry when you bring up these end of life conversations? And have you had that experience? How did you navigate it?
Yeah.
It's usually it's usually
Yeah.
denial. It's usually denial. And they're not ready to accept that situation, and they're not ready to accept that conversation at that time. And so then you very gracefully sort of back away and say, I think it would be good if, we think about this and talk about it next time. That's been my experience.
Great. Yeah. Anything
Yeah.
else?
I just going to just for my personal experience that I had it a few months ago. And one of my relatives passed away, and when those hard conversations came up to the doctor, and he was smiling, and then he changed the chapter. Like, oh, doctor, this is this is that. And the doctor says, oh, sir, do you understand what I say? And then he started getting a little angry because he was so denied. And I was right there with him. And I said, calm down. The doctor he just want to explain to you what is going on. Listen to him, and then you digest it little by little, and we're here to support you. And if you have any question, I'm here. I'm gonna translate it to you. The doctor is here to hear you. What is your thought? What is that? To make sure you let them know they're not alone. So when those angry and those moment aggressive is coming, they're gonna come. Actually, they're gonna come. It's not easy. They don't want to hear anything like that. And when we start to talking about the conversation, we have to be very carefully. We have to start like a very, very smooth conversation. It's not like you're gonna come bam, 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 bam. Some people take easy, some people they're not. So we just have to be very mindful. So those and we don't want to have to come down. Yes, and we have to support them no matter what. We have to support them. So just breathe and let them know you're there to support them, and they feel it.
Kathy, anything you wanted to add to that?
I think I share the same experiences as Lisa and Jenny. And I would say just I keep saying just be patient with them, and also it, sorry. I feel like sometimes they can feel like they have to do this right now. They have to think about it right now, right? So just a reminder is like, not right now. We're just starting it, and then you can come back when you're ready. And we could just hope that it's sooner rather than later.
Yeah.
It's a lot to process sometimes. That's a great thing to say, Kathy. You can come back to it. I've had situations in my family. It's this data that's being thrown at me is really overwhelming. And even though I'm a physician and I can take it in and very quickly assess what's happening, I don't want to. I need to take a step back and think about it. So for patients who aren't as experienced, I think that's a fabulous, advice.
Yeah. Yeah. And I also just to chime in, I think we often forget that anger is an okay emotion, right? As a response. Obviously, there's like aggression and then there's
Yes.
just the anger as an emotion. And I think that's where we can maybe take a pause and say, like, I can see that this conversation upset you, or I get the impression it upset you. Would you like to take a break from this conversation? Would you like to join me in doing like a breathing exercise? What usually helps you?
Yes.
Like kind of using those like reflective skills when possible. Because when we respond with anger or like upsetties, is the way I usually call them, upsetties, people don't always then it becomes a butthead situation, right? But I respect that those can be really like challenging situations and conversations to have. Um, especially if you're new to them, but even if you're not, you still might also feel like, oh, and then think about where is that anger coming from, maybe for your client or patient or yeah.
Yeah, and to let them know that there is resources available, group therapy that they can join, and we can send those referrals for them. Also, they have available like dance group where for senior or mindful group when they can relax and things like that. To do some resources for things that they to find some hobby. Maybe they like it before, and maybe they stopped doing it, and they want to start to doing to keep their mind busy from that crisis that they're going through. That might be helpful too.
Yeah, absolutely.
Mhm.
Yeah, thank you.
I have a question for the physician. Could
Yeah.
you hear me?
Yep.
Yeah. So, culturally, we totally different, especially Latino. When doctors talk about chronic disease or amputate some part of the body to the people, it's very difficult. So my question is, there is no way that the doctor can talk to psychiatry or to psychology before giving some difficult, like a prognostic to the patient, because I have the experience with people that they've been in good spirit, they got some disease thing, but the doctor told the patient about the reality that they have. So for Latino cancer, talking about diabetes or chronic diabetes, something like that is devastating for them. So we not assimilate like we think that is the end of the life. So they start preparing for for testaments, for what's gonna happen, and they drop in a serious depression, stress, anxiety. So my question for the physician is: there is no way that they can like hide some news like that, like you got cancer, stage 4, or you have 3 months to live, something like that.
Well, that's where things get really hard. And we do have access in our clinic to behavioral health support, Spanish speaking counselor. And if we know ahead of time, and often the families will tell us, we can slow it down. And we try to be really sensitive to the fact that, patients can't always take everything, families can't always take everything. So I try to sense the room and see how much we can say. But I will tell you this, everybody knows when they're sick and everyone knows when they're dying. So it's really a delicate dance with the family and the patient. I've had patients' families say, don't tell him. I don't want him to know or her to know that they're dying. I guarantee you they know they're dying. So sometimes it's easier. It's what you're saying is quite correct. If they have psychological problems or if there needs to be support, that's really when you want to bring in a counselor. And you can do this ahead of when you're going to have a conversation. You can do it at the same time. You can do it afterwards. I find the sequential meetings are really helpful. But ultimately, you really do owe it to your patient to acknowledge that they're ill and offer them the kind of support that they're going to have. And really, patients will tell you, I don't want to know how long I have to live. Some want to know. And I always say, no one knows for certain because we really don't. But it's really a delicate balance between what you need to tell the patient, how you tell it, and when you tell it, and with the family. But it's ultimately best for the patient to know the truth in as gentle a way as possible. But you don't have to say it all at once. It can come over time.
Thank you. Thank you so much, Lisa. And we are at 1 o'clock. I had just a handful of wrap ups. But if you have to jump off the call, I completely respect that. I just wanted to share a little bit of some of the community partner events and connections. Goals of Care of New Jersey has a community ambassador program, and it's a way also to learn more about the New Jersey Family Care Medicaid Community Palliative Care benefit. If you are able to, or you weren't able to join us at our last session, they actually presented on it, so you can learn a little bit more information there, and the links are in the chat. And then also on Tuesday, I will be presenting in Fair Lawn about the Mayor's Wellness Campaign and its connection to age-friendly initiatives across the state. If you are in that community or around, feel free to register with us. And lastly, I just wanted to say thank you to our panelists, to all of the folks that joined us today. We really appreciate that. And additionally to our Mayor's Wellness Campaign sponsors who make programs like this possible. So thank you again. And I appreciate your time and your consideration, your insight and your expertise. And thank you.
Thank you,
Thank you so
everybody.
much
Thank
for
you,
having
Kathy.
us.
Yeah.
Thank you. Bye.